Hey guys, welcome back. I hope the previous video was helpful for you. We talked about some of the things that cause fever. Mostly we focused on the infectious causes, and we talked about when fever itself or the underlying cause of the fever can be worrisome. As an emergency physician, like what things do I look for that let me know whether I'm worried about your fever or not really? And so if you didn't catch that, go back to the previous video and watch that. It's 12, 13 minutes long. And now I want to chat with you a little bit about some of the things that cause elevated body temperature, not even related to infection. So we know that bacteria and viruses can cause our fever to go up. We've all experienced that. But there are some other things that can come in that can make our body temperatures go really high, and even see some of those fevers where the fever itself is probably actually dangerous, unlike with the infectious causes of fever. All right, so before we talk about ways to treat the fever and how to handle that when it happens, let's actually go through a list of some things that can cause a fever, but infection isn't involved at all. One of the first of those that come to mind is illicit drugs. So illegal drugs. Maybe you've heard of a rave. So what happens at a rave is people are doing amphetamines, or more specifically usually MDMA or ecstasy, and so that can cause them to want to move their body more, and they're in a hot, tight, small environment, and maybe they're not drinking enough water. And so what we can see, there are a couple of things happening all the way down in the cell level, the mitochondria, how it's handling energy. It's not using that energy, it's actually dissipating it. And so what happens is that causes our core body temperature to rise. And then MDMA also releases serotonin. And so you have, again, a bunch of people feeling empathetic and lovey and dancing and staying up all night. And so drug use, illicit drug use, is one of those things that can cause our body temperature to go really high to those dangerous levels, 106, 107, 108. And those require rapid cooling and rapid attention in order to prevent somebody from losing their life. Another thing that can happen that can cause a fever is drug-drug interactions. Now, don't get freaked out. If you're already on some medications, you don't have to go look and see what those interactions are. But it's something that we're going to think about. If we think that your fever is not caused from an infection, we start thinking about, okay, well, what combinations of drugs are you on? Because some of those can interact and cause what I already mentioned with serotonin. So serotonin syndrome, you have drugs that actually each in and of themselves will increase serotonin levels, and then they get together and they start partying in your body, and it causes the serotonin levels to go higher. And that can cause elevated body temp and muscle rigidity, confusion. So drug-drug interactions is going to be something that can cause elevated body temperature or fever without infection. Another thing that comes to mind is there's some psychiatric drugs that can cause that. They cause a phenomenon called neuroleptic malignant syndrome. And so if you come in with confusion and altered mental status and elevated body temperature, we might take a look at your list of drugs and see if we think that anything there is contributing to that. Kind of along those lines is some people react adversely to inhaled anesthetics in the operating room. So not really something that I'm going to see at our office or in the ER, but certainly anesthesiologists need to be aware of this phenomenon called malignant hyperthermia. And usually you have a history of that or a family history of that, but that's going to be another thing that can cause unwanted elevated body temperature. And then one of the last things that comes to mind is heat stroke. So you guys have probably heard of that, but maybe you're unclear what that is. And so really what happens is we're in an environment where the heat is really high, but our body loses its ability to really dissipate that heat. And so it's kind of like we're in an easy bake oven. So our temperature starts rising and our body's not sweating. It's not letting go of that excess heat. And so again, that's going to be elevated temperature, not related to fever. And those degrees of temperature, we can see 107, 108, and those are, unlike fever related to infection, primarily dangerous. So again, that's going to be one of those things where when you see an emergency physician, he or she's going to act quickly to try to get your temperature down to save you a bad outcome. So let's not overlook a really important aspect of fevers, especially in kids. If you have children, you've probably heard of this idea of febrile seizures, or fever seizures. And surely, Dee, that has got to be something that's serious and life-threatening, right? Well, the good news is that febrile seizures usually come from infection, and because they are fevers related to infection, they themselves are not usually dangerous. Now, what happens with a febrile seizure is our body temperature changes rapidly, and when our brains are immature, usually we should see this happening in kids 5 and under. When our brains are immature, they have a lower seizure threshold. So elevated temperature, or even get this, a rapid drop in temperature. So you got a high fever and it drops quickly, has been reported to cause febrile seizures. So when that happens, what are you going to do? Well, you're going to freak out. I have 5 boys. If one of my kids has a febrile seizure, I'm a seasoned emergency physician. I'm probably still going to freak out a little bit. So if your kid has a febrile seizure, you're going to bring him to the emergency department or get in right away to see your doctor. But then, as the physician evaluating that child, I'll let you in on a little secret. We really just evaluate your child in light of the fact that he or she has a fever. And then given his age group, we sort of figure out how concerning that is. That is assuming that everything else is playing out like normal. As an example, usually if a kid has a febrile seizure at home, by the time I see them in the emergency department, they're waking up, they're looking around, they're acting themselves. They usually look great. They might still have the fever, but the seizure part of it has gone away. So when I see a kid who's alert and playful, had a febrile seizure at home, I kind of rest assured that everything's probably okay. We still evaluate the kid and maybe run some tests or at least do a good exam. But in the end, we kind of take the fact that there was a seizure out of the picture and evaluate your child for the fever and then give you some reassurances. I always tell parents, this could come back. Your kid could have another febrile seizure. And when she does, you're going to bring them back to the emergency department, and we're happy to reevaluate and make sure that everything still looks okay. But there are some families out there that have had this common enough that, maybe the parents don't always get overly worked up. They see it's happening. They make sure that the child is safe. So you want to make sure that you help him or her to the ground and that you just stay there with them. And usually these seizures are over in less than 5 minutes. By definition, they have to be over in less than 15 minutes. But 15 minutes feels like 15 hours when your child is seizing. So I get it. Parents all the time are like, how long did it last? They're like, oh, it lasted for like 20 minutes. And really looking back, it was probably 2 or 3 minutes. It just seemed like an eternity. So that gets us to the point in the little chat where we talk about how do you treat fever? Like what should we be doing at home? Do we give Tylenol and Motrin? Do we not? And I'm here to tell you that I'm a huge fan of Tylenol and Motrin in my children when they're sick and in me when I'm sick. I don't want to feel a fever. I don't want to feel like poo. And so I treat myself with Tylenol and Motrin, and I'll let you in on a little insider secret. Come here, listen. You can give Tylenol and Motrin at the same time. Yes, acetaminophen and ibuprofen, different classes of drugs with different side effect profiles, absolutely safe for you to give at the same time. Now, you do not want to give either of them too frequently. So, for example, if you're a fan of alternating Tylenol and Motrin every 2, 3, 4 hours, you can't then give both Tylenol and Motrin every 2 hours, right? That's not good. So you still have to keep with the dosing schedule of each drug. Normally, Tylenol we think of dosed as every 4 to 6 hours, and ibuprofen is dosed more every 6 hours or so, 6 to 8 hours. But if your kid has a fever and you want to give a dose of both Tylenol and ibuprofen at the same time, absolutely safe, and I would commend you. What about other things? Well, there's a lot of things, like I said, that grandmas pass around. There's the alcohol baths. Don't do that. That's not necessary. There's putting them in cold water. Again, if you have a fever related to infection, like from a bacteria or virus, there's no need to go to that point. You could maybe do some lukewarm water if you wanted. Probably no harm in that. But my experience is that in general, if you give a weight-appropriate dose of Tylenol and Motrin to your child, the fever goes away. Now, I do find that the bottles tend to underdose those. So if you're giving, the directions on the bottle tend to underdose those. So if you're giving it and it's not working, if you're a member of our direct primary care membership, you can just text me or on the north side, Dr. Parker, and say, hey, I just, little Johnny's got a fever and this is what I'm given, is my dosing correct? And we'll be glad to assist you with that. But in general, once you treat with, especially if you treat with Tylenol and ibuprofen and the fever's still there, you're kind of stuck. Like, we don't have any other drugs that we can use that are going to be safe to add to those. But I'll tell you that really treating kids with fever comes back to, like, treat the kid, not the number. So literally, if my son has a temperature of 103 and he's running around acting fine, it's absolutely acceptable for me to not give him medication for that. I really only need to give him medication to the degree that he's miserable with his symptoms. Now, sometimes in the emergency department, I really want to get that fever down because sometimes kids really look bad, like sick. They look sick with their fever, but then when that fever breaks, they look like $1,000,000. And having done this for 25 years, I'll tell you that when somebody has a really serious infection, especially in that pediatric age group, if they have a really serious infection and we get the fever down with Tylenol and Motrin, these kids still look pretty sick. So one of the distinctions that I try to make as I educate parents on what a sick kid looks like to an emergency doctor is, if I started an IV on your child, would he or she fight me? Right? So parents throw around this term lethargic, which to them just means his activity level's down, he's normally running around playing, and he just wants to lay on my lap. Medically, if you tell me that your kid is lethargic, to me that means that if I try to start an IV or if I try to do that lumbar puncture, little Johnny's just going to lay there. Now that's a kid that I'm really concerned about. So sometimes seeing a kid in the office or in the emergency department, I really want that fever to come down because as the kid looks to me right now, I'm kind of concerned because he is kind of listless. But I'm thinking if that fever comes down, he looks great, I don't have to do as broad of a workup on him because he's just really under the weather because of the fever, not because there's a more serious underlying bacterial infection going on. So in conclusion, let me just say, fevers are okay. They don't have to be this big scary thing, and it's fine to treat them. Now, the people that I said have the fever not related to a bacterial or viral cause, so the fever is not related to infection, I'm going to tell you right now, when somebody has that, they look sick. They look horrible, right? That's somebody that right away, if that's a family member of yours, you are going to be overly concerned because they're not acting right, they're confused, they're out of their head, they're doing strange things, and their fever is really high, and they look horrible. So don't think that a little elevated fever in a friend or family member automatically points to that they've got something horrendous, that they've been partying at the rave, or they got a heat stroke or something like that. People with that level of elevated temperature, 106, 108, they look horrible. So, and for everyone else, the fever related to the virus or bacteria, it's really just treat the fever and try to feel better. And then drill down to the underlying cause. Most of the time, most fevers are caused by viruses. And you guys get tired of us telling you that. You come see us and we're like, well, you have a virus. Not a whole lot to do. Treat your symptoms and you'll be better in a couple of days. But for the most part, that's truth. And I know that people get really concerned about going and spending their healthcare dollars on an urgent care visit or an ER visit just to be told that they have a virus. And I think that's part of the beauty of the membership model that we're going with. So if you do get sick with a fever and you need to come see me, I tell you, if it's a virus, I'm going to tell you. I'm not just going to indiscriminately throw antibiotics at you. I'd rather take the time and explain why antibiotics won't help, why they'll simply give you diarrhea, and they won't make you better any faster. But at least you didn't spend a ton of money. You just came in to see me, and all that's included in your membership price. So when it comes to fever, it's okay to just take a pause, take a breath, kind of evaluate the overall situation in yourself or your spouse or your children. Treat it with some Tylenol and Motrin, provided no one's allergic to Tylenol or ibuprofen, no one's got kidney or liver problems and shouldn't be taking that. That's a different discussion for you to have with your doctor. But hopefully you find this helpful. If it's brought value to you, please click the share button, distribute it. I think there's a lot of people around that could benefit from learning more about fever. And I'll be back on here sharing some other insightful information about medicine and health and wellness. And we'll just try to give you guys a bunch of good stuff so that we can help you save your healthcare dollars and maybe not spend a fortune when you don't really have to. All right. I love you guys. Bye.